You're listening to the Yoga Medicine Podcast. I'm your host, Tiffany Cruikshank. Our podcast brings you information and resources to enhance the therapeutic effects of your practice based on a deeper understanding of anatomy, physiology, and the integration of modern science and research with traditional practices and experiences. Join me and my co-hosts, Rachel Land and Katya Barch, as we dive into all things yoga, research, and wellness. Welcome back. I'm excited to talk on a very popular topic this time with Rachel. We're talking about Yin Yoga and who Yin Yoga is not for, and really talking about some of the, I guess, maybe cautions and contraindications of a Yin Yoga practice. This question came up recently, one of our office hours calls, and brought up some good discussion. So we thought it'd be a great topic to bring to one of our podcast episodes. So
I think
here we
it's one
are.
that I'm keen to talk about because when you look online, like when you do the standard Google of, who should practice yin yoga or who should not practice yin yoga, it kind of comes up like you're doing something incredibly dangerous. The cautions are very strongly worded. And it makes me think, our perception of risk in the yoga world is, I think, a little bit skewed. We're not asking people to play tackle football or to drive race cars. It's not, objectively a very risky experience. And yet sometimes I think we lose sight of that a little bit when we're talking online about cautions and contraindications. We might take them a little
Well,
too
and I think
seriously.
on the others, the flip side of that is we also come to our yoga mat to feel better. And yes, I completely agree with what you said, but we also come to feel better and we don't want to make things worse. And I think, like anything, it's worth a discussion of, what are the things that we might want to avoid. And I think any good modality should have any therapeutic modality should have some contraindications, because there's no magic cure all, no matter how great the drug or the surgery or the medicine or the nutrition or whatever that might be. There's always contraindications, and that's what really helps us develop our therapeutic awareness of things. And for me, it was kind of how we created yoga medicine too. When I was working as a healthcare provider within my network of healthcare providers, a lot of them wanted to be able to refer to yoga, but as a healthcare provider, you kind of anyone who's ever done yoga knows how negligent it could be, because you to refer to yoga because your shoulder patient with a shoulder injury, might end up in Ashtanga, they might end up in a chanting class, they might end up in Yin. And yes, maybe Yin might be very helpful in some cases, and in other cases, maybe not so much. And sometimes it's just a matter of, where we want to put our time. Time is, limited for everyone. And, ideally, I think everyone could probably benefit from a Yin practice. We'll just start with the end in mind. Like, I think everyone could benefit from a Yin class if time was not a factor. But, time is a factor for pretty much everyone. And so, how do we get the most out of our practice? So,
I think you've hit on the point that came up for me the most often while I was thinking about this topic, which is that people tend to get very strong polarized views because there seems to be this underlying assumption that if you're doing yin, it's all you're doing. You're not doing anything else. You're only doing yin. And so some of the cautions and contraindications have this underlying assumption that, well, if this is all you're doing, it's going to be unhelpful. And I think we should right from the outset say, we're not talking about this as the only movement or mindfulness practice in your life. There might also be other things that you benefit from. You might benefit from other things more, but that doesn't necessarily mean that you have to take yin off the table if it's something that you like and enjoy.
and I think we can also start with Yin's not going to replace movement practices. Like,
Yeah.
there's such opposite yin and yang things, and one doesn't replace the other. So it's not a matter of, do I do vinyasa or yin? Like you said, it's just a matter of, is yin yoga right for me? And,
Yeah, and you see
and
you
let's
see this
just,
argument in the fitness world all the time with should I do strength work or cardio? And the honest answer is, well, yes, you should obviously do strength
yes
work
and
and
yes.
cardio. But the argument
And
is
the
always like
stretching
one's
and the
one's one's
myofascial
right and the other
release
one's wrong. Yeah, exactly. So
and
we
good
could probably start
nutrition
with
and
that.
sleep. Yeah.
Yes.
Well, and
Good
let's just distill
relationships.
yin down to its nuts and bolts and say, you know, primarily when we talk about this as a therapeutic modality, when we talk about contraindications, what we're really talking about is static stretching. And as yoga practitioners, we know there's a lot more to yin yoga than just static stretching. And that's what makes it such a beautiful and I think rich therapeutic modality. But when we talk about the mechanical influence and the things that we need to consider, really we're comparing it to stretching in a therapeutic modality. And I think we've mentioned this on our podcast before a lot of times. There's not a there's not much great yoga research, like good, high quality, upholds to, the gold standard of of quality and research. So we do often have to compare it to other things. And there's tons of research in stretching. There's too much. You can just be overwhelmed, I think, and find something to support really anything. But what we're really talking about is static stretching here. So let's start off with, I think, the most obvious one. And this was Rachel made a really nice list for us and kind of looked at, I think, a lot of the things that are commonly thought of for this. And the first one I think that comes to mind to talk about is hypermobility, right? And people and I want to hypermobility as a diagnosis, but I will actually personally, I would like to just put in this category people who are just also really flexible.
Mhm.
Not as a diagnosis, not hypermobility as a diagnosis, not a connective tissue disorder, but you know who you are. You go to
Yeah.
the yen classes and you're like, "Oh, I can just lay my belly on the floor or on my thighs," or and I used to be this person, so
I used to be this person too. I vividly remember a yin class actually where I sat up in front of the fireplace because it was nice and cozy and warm in winter, did a wide legged forward fold, a straddle, rested my stomach on the floor, felt absolutely blissful and amazing, and then was pretty uncomfortable the following day. What a surprise.
right? And I'm the same. I had the first few years that I did yin yoga, and I didn't do it regularly. I was doing more Ashtanga and Vinyasa at the time, and I did what I thought was yin yoga. And there wasn't a lot of instruction telling me not to do it this way at the time. Where I did the same, put my belly, go as far as you can. You go to your end range of motion, and again, feeling awful. And it took me a while to really understand the what, why, and how behind it to be able to adapt that. But I think the easiest one that we could put a label on, I think if we were going to pick one thing to be like, you probably not that you need to be afraid of it, but probably not the best use of time if you have hypermobility, definitely as a diagnosis, or if you just tend to be really mobile. And, I'll put the caveat out there that most people who are super flexible have some areas that aren't as flexible. The problem is you go to a yin yoga class and you're doing all the things, and usually you're avoiding those things because you like laying on the floor. You like the endorphins of stretching and feeling it and going deep and feeling like you're doing something. So, yeah, I think the first person we could think of is just that broad category of both of those.
Yeah, and the important thing I think that you've pulled out there is feeling something. Because if you're a flexible student, there are so many times in yoga where the person next to you is groaning about their hamstrings or their piriformis and you're feeling nothing. It's like that's, downward dog, that's not a stretch. I'm just kind of using my upper body strength for a minute before I go on to the next flow. And so to get to yin and be able to go super deep into a pose and actually feel something, to feel a good, satisfying, deep stretch, I can see why it appeals to people who are mobile, who are looking for the same quality or intensity of sensation that they see other people getting all the time. And that's the downside because to get all the way so deep into your range of motion that you're getting really vivid sensation might not be a helpful thing for a really mobile joint. And I'm sure we'll talk about it. There are definitely ways you can practice yin that are really helpful for mobile people that train you to perceive much subtler sensations, to kind of find the beginning of your edge as opposed to the end of your edge. But I think that's the trouble is you feel something and that's amazing. That's intoxicating. That's what other people go to yoga for.
And on that, let's back up and say that, one thing that the stretching research will agree on for the most part, there's always exceptions, there's always outliers in the research, is that static stretching is a great way to work on passive range of motion. passive, of course, and that's another whole nother topic. It doesn't mean I can actively control it and use it in sports and function, but I have to have the passive range of motion before I can actively control it. So it is one of the best ways that we can create more passive range of motion. And so with that in mind, and there are other ways, again, another topic, but a longer topic, but because of that, if someone's already hypermobile as a diagnosis or just has a lot of range of motion, do they need more range of motion? And that's a no. And so yeah, I think especially for diagnosis of hypermobility, actively pursuing more and more range of motion, definitely not helpful. Definitely something we want to stay away from. Um, for people who are not diagnosed as hypermobile. And so it's probably just easier for hypermobility people to just do something else because it
Mm,
can be very frustrating for them to go and do a yin class and search for sensation because usually they're not feeling any. And I find something like MFR to be a much better, more effective
mm,
tool, easier to use, quicker to use. And maybe at some point they can back off those yin poses and not be at 100% of their capacity and be more like what we teach in our yin training, which is like
mhm,
60 or 70% of your capacity, which is kind of where you just start to feel what I call a tug on the tissues before the stretch. It's like things are lengthening because I do want to feel that I'm putting some, in quotes, tension. We tend to think of tension as a mechanical loading to the tissues, not as a bad thing, but a tensioning of the tissues, a tugging on the tissues.
mhm,
We just don't want to be in that deep range of motion. And so for someone who just has, they're more flexible, they're on the more flexible end of the spectrum, which is a lot of people in yoga. There are definitely some benefits to doing yin that aren't about range of motion.
mm.
Um, but what I don't want to be doing is pushing myself deep into that and going for like the endorphin mode that you're speaking to. There
Yeah.
is not quite compelling evidence yet, but there's evidence that suggests by Helen Longavine, and we've probably talked about it on this podcast at some point before, that suggests that the static stretching can be an anti-inflammatory, can be anti-fibrotic, which both are really important. She's got some interesting research on cancer that's jury's still out. But just the health of the connective tissue, the hydration of the connective tissue. But again, I don't need to go deep. It's not about mobility or range of motion, but I have to be able to back off. And what's hard with these people, both groups, hypermobility and people who are just really flexible, is what you said is feeling anything. And
Mhm.
so they keep coming back to that 100% or maybe 90% of their full capacity. It's hard for them not to. And so what
Mm.
I often guide is like, just back off to that 60, 70 and search for the nuance. And then as I'm working with someone therapeutically, I'm also getting them to load the tissues and do other things that are more
Yeah.
important,
Yeah.
but if you love the yin class for other reasons, like there's so many reasons, like we said at the beginning, to do yin besides just static stretching. Um, that's definitely, I think, a helpful way. I think everyone should approach it that way, honestly.
I agree, and I've talked about this hack before. My method of changing my approach to yin was to practice it in jeans because, most of the really deep stuff for me was hip stuff. And so when I put jeans on, I would feel the beginnings of something. I'd feel some tension in the fabric, or I'd feel some pressure or compression or shear in the fabric. And that would be what prompted me to stop and go, okay, hang on. Am I feeling anything else? Am I feeling anything in my
Uh,
muscles? Am I feeling anything in my fascia? Yeah, and it worked a
are
treat
you
for me.
able to feel? I feel like if I had jeans on, I wouldn't be able to feel the tension and the tissues develop, but you could feel that.
I can, yeah, because the key for me is I think I was bypassing quite a lot of subtle early sensation to get to that really deep stretch. And if I go in quite a bit slower, I can feel something, especially these days when I don't really ever stretch. I can feel something much, much earlier than I would have thought I could feel something. It's not a big, juicy stretch. It's not, deep, but it is something. It's a sense of the tissue lengthening, and it just gives me time to recalibrate my senses to a higher level of sensitivity. So that worked for me. I don't know whether that would work for everyone. My jeans had a little bit of stretch in them, so I'm not talking plain denim, but that was a really helpful way for me to just kind of reprogram my approach completely.
Yeah. Yeah, I think this is the probably the most important category to consider, and really I think with people who are flexible or diagnosis hypermobile, it's just an easier class to skip because there's so many other options that can be more helpful. But again, if you really love it, there are ways to approach it. I think yin for a lot of people can be a gateway into meditation because
Hmm.
meditation and being completely still with no tactile sensation can be really challenging and overwhelming for some people. And so I think of yin oftentimes as a gateway to meditation. And if I'm using it in that context, then I could definitely approach it in that way. And again, just really back off so that I'm not pursuing more range of motion. More is not better. We know this in orthopedics. We know this when we look at the health of the joints. More is not better. We really want the middle path. We want to have that strength and tissue stiffness and stability, but we also want the range of motion to be able to do all the things that we want to do in our lives. And it really is that Goldilocks scenario. So,
Mm.
just keeping that in mind for the health of your joints, long term, especially, we really want to have that middle path. So, if you already know you're like in pigeon and your belly's on the floor, and again, most of these people who are just more flexible, there's certain poses that they're more flexible at than others. If you're in pigeon and your belly's on the floor, I'm like, I can probably just check the box on this one. I don't need this. Maybe I stay upright in pigeon, or maybe I come upright and do a twist, or find something that's challenging, and if I think about it that way, then I start to bring, more this idea of balance into my practice, which can be helpful in a lot of ways. So
And there's one more population that we tend to kind of lump in with this category when we think about cautions or contraindications of yin, and that's people who are pregnant, where their ligaments have more than usual laxity. What are your thoughts on practicing yin while pregnant?
same thing, copy,
Hmm.
paste, repeat.
Yeah.
Yes, I think and I think for pregnant populations, sometimes it can be helpful and feel good to them, but the caution is again because of the relaxin, I don't want to be stretching things, especially now because it's going to it'll stick around after pregnancy too when those hormones go away. So, yeah, I mean really just same cautions pretty
Hmm.
much. And again, I prefer MFR for pregnant populations. I think it gives better pain relief for like hips and low back and things that tend to be problematic, sciatica and lower back pain. And so I think those can be, um, I find usually more effective tools than yin. But again, as long as you're not going really deep and forcing and pushing, if I'm staying in that really gentle range, which again is hard in these populations where flexibility comes easily, as long as you're doing that and able to do it and it gives you something else other than range of motion, that's fine by me.
Yeah. The second population that tends to come up a lot are people with spinal injuries because most yin poses are on the floor. Many of them are seated or seated forward folds. And we know with disc herniation that can be painful or uncomfortable for some people, depending on where the herniation is in relation to nerves. What are your thoughts on yin and spinal injury?
Well, I have a personal I have a personal experience with this one. And I think how you approach it is really important. The problem
Yeah.
is in a group yin class, we don't have time as you know. I mean, you know all of this as well. We don't have time to go around and speak to everyone and ask everyone how they're feeling. We hope as teachers when we offer options like, if it feels good, try rounding your back, that people are listening to that and taking those. Although we know that people tune out, it's just our human tendency to not listen to every single word that's spoken. We're, also in our bodies and listening to our bodies. So the biggest issue, like you said, is with disc herniations or bulging discs, is that as I flex the spine, I put more weight into the disc. And so I put more pressure on it, and this is healthy in a healthy scenario because this is actually how our discs get fluid. These changes in pressure are a great way to create this imbibing mechanism, which is those changes in fluid actually changes in pressure actually pull fluids into the disc. So in a normal population, great, healthy, wonderful. But if I've got a disc irritation that's causing pain, and I'll know it right away. So this is one of those things where it is intuitive. If you have a disc herniation, and or a bulging disc, and this is hard because it lasts for a while and then at some point things get better, and then sometimes people identify with that for the rest of their lives.
Hmm.
But ideally, if I'm doing something to fix the disc herniation, at some point I should be fine with this movement. But I have to, and that's a much longer story of fixing disc herniations, but I personally had a disc herniation. It's been almost, I want to say almost 20, 15 years now, I guess maybe. Yeah, I guess about 15. been a long time. And yeah, and I can speak from personal experience that rounding, like right away, you feel that pain. You know exactly that you don't want to be there. But in those forward folds, I can also approach it by keeping a flat back or doing Supta Padangusthasana with my back on the ground in a lot of those
Yeah,
forward folds. Because I do think there's something that can be helpful for some people within a yin practice, depending on what's going on. And, that's really more of an individual person to person issue, of course. How much of it is a stability issue and how much of it is, working with connective tissues and mobility and things. But so in forward folds, just keeping the back straight can be an option. Again, I'm listening and backing off. And so that's why if you listen to my yin classes, usually pretty much in all the forward folds, I always start with the back straight and then I give the option to round the spine if it feels good, which just makes it really succinct and easy
mm. And I
for a
think
group
one thing
class.
that's
But
lovely about yin is, unlike most other forms of yoga, there is time. If you're in a pose for 2, 3, 5, 7 minutes, depending on the class, you have got time to give people options. So if you're a teacher and you see somebody, screwing up their face or gritting their teeth or holding their breath, you do actually have time to, pad your way through the class and go, how are you feeling? You look a little uncomfortable. Oh, would you like to try a version lying on your back instead? Or, hey, try it with your back straight and see if that feels any better. There is a little more of that space as a teacher to be looking around and giving people options. And
yeah.
instead of everybody in the class having to be in an identical shape, the idea is you're hoping that everybody in the class is feeling something in the target area, and that might look completely different for different people. Some people might be lying down, some people could be sitting up. It just depends on your targeted tissues.
I will say though, I, as a teacher personally, really love having quiet in a yin practice. I think that introspection is such a big part of it. And some people have a really good poker face. I know, like,
True.
sometimes you and I know, like, you can read the room and sometimes you can see some, like, glaring, cases of people needing some help and needing a different option and, definitely going over and helping those people. But I'm also trying not to disrupt, the quality, the space, obviously that doesn't mean I'm not going to go help someone, but it is tricky because I don't think you
Mm,
can get to everyone. And I think that a lot of people have just learned to grit their teeth and deal with it. There is the other side of it too for things like stenosis, flexion of the spine is great. Like we want flexion of the spine. And things like osteoporosis, we want to avoid putting that into the bones. And so yeah, I would say osteoporosis could be another one, and disc
mm,
herniations could be another one that just could be easier to avoid yin because in a typical yin class, there is a lot of spinal flexion that happens, and not all teachers know to cue to that or to speak to that. Um, but there definitely are ways to work around that. You can skip the forward folds and lay on your back and do supine versions of things,
mhm,
which is really great. Um, you can again keep a flat back for the disc herniations. Um, yeah, so again, I think it comes back to like what's your purpose? What do you like some people get really attached to yin and like it again for maybe more meditative reasons or maybe it's they're only quiet in the day or
yeah.
whatever the reason might be. As long as I have a little bit of awareness of the how to adapt it, I think that's fine. But again, if we just wanted to be easy and say like, hey, because there's so much complications in adapting this, it's easier just to avoid it if you have osteoporosis, osteopenia, disc herniations, hypermobility, any of the hypermobility spectrum, I think would probably be good on the list.
Yeah, sure. Yeah, and I think you're right. What we've been hinting around and maybe haven't said overtly enough is the the big benefit of yin outside of passive stretching and increases of range of motion is stillness and quiet. The stillness and quiet that we don't always have time for in more active practices. And for some people, this can be the challenge of the practice of kind of stilling the quiet of the buzzing mind when there's not much external distraction going on. But for other people, and I think especially as you get used to it, that can be the magic, that can be the soothing balm of yin, is that there isn't much going on around you. And so you really do have space to turn your attention inward and to investigate your internal landscape instead.
Right. And I will say too that you also just want to go with the pain because there may be people who don't have, in quotes, excuse me, diagnosis of a disc herniation or a bulging disc, or osteoporosis or osteopenia. Osteoporosis or osteopenia aren't going to give us the pain feedback, unfortunately. So those are harder to work with. But what I would say for like disc herniations and that anyone who has pain when they're rounding their spine should again just modify, find that
Mhm.
flat back, go supine. It's not diagnostic. It doesn't mean that they have a disc injury. um, but uh, maybe there's just a little irritation there or something else going on. We can't explain it. We can't know just from that one piece of information. But anyone who's having pain there, and technically speaking, degeneration shouldn't be a problem, but some people with degeneration might have pain with rounding as well. And so degenerative disc isn't really the same kind of circumstance, and usually we can work with a lot of those symptoms for all of them with a well-rounded approach, which we speak to in a lot of detail in our spine training
Mhm.
as a longer conversation. But again, I would really go by what you or your students feel, and um, just always stay within those gentle ranges.
What do you think about older people in general? Because that's the next kind of category of people that I see as cautions or contraindications for yin. Like, oh, you might have degenerative disc disease, you might have osteoporosis, you might have changes to your range of motion thanks to osteoarthritis. So, you know what? It's probably just safer for you not to do yin. So, older people go elsewhere. I've seen that sort of.
Right.
that sort of sentiment online.
Right, and I have such mixed opinions because yeah, we don't always know when people have osteoporosis, and a lot of the group classes have, mixed ages from 20 somethings to 80 somethings maybe. And so, compensating for that in all classes all the time would be really challenging and leave out a lot of poses, potentially a lot of the forward flexion poses,
Mhm.
which would be left out for osteoporosis. So it would be a little bit challenging, but there are two things that I think are really interesting within this population that make yin very interesting within this population. And one is the fact that as we get older, we tend to have more type 1 collagen, which is a stiffer kind of collagen. Type 3 is more elastic. And so, in general, we tend to become a little stiffer through the phases of our life. And part of that is because we're also not as active. So, there are ways to obviously work with that and support that. And especially for females, this is one place I think where it's almost easier for females because we have that clear line when we're postmenopausal. We see a quick shift in that collagen production, which becomes again more type 1 of that stiffer type of collagen postmenopause. And so, for that reason, I think yin is a really great one. And I find a lot of people a lot of seniors, 60s, 70s, 80s, um, love a yin class. And I think done gently, and again, if they have osteoporosis, they should be speaking with someone about modifications. But it can be really great. The second reason is that there was um, a really big systematic review that came out that looked at, um, really not specifically yin, but people, and really it was just this general, but people who stretched regularly had a lower arterial stiffness, and that's pretty freaking valuable when you get older. Like having lower arterial stiffness is a very important thing, and something that I think made a pretty big splash in the scientific realm. And so, I think there are other reasons why it might be really helpful. But again, of course, osteoporosis is one thing to be cautious of. Disc injuries are actually less common in like a senior population. Usually that's
Mm.
more midlife. It's usually more degenerative disc, which doesn't have to be painful.
But
What
you
were the
can
other
come
ones
up
you mentioned?
against joint replacements or
Yes.
osteoarthritis in joints that changes range of motion or makes it less comfortable to have body weighted deep range of motion. I mean, this is the population
Right.
I teach, not 80s, 90s, but 60s, 70s. And I do teach yin to that population. I teach a yin and yang class every week. And my general approach is just that it's very, very rare for me to teach a seated forward fold. Every now and again I do, but very, very rare. And you'd be surprised how many other yin poses you have in your arsenal. Most of them for me are either on the floor or supported on props pretty close to the floor. And then it's just a matter of making sure that everyone's kind of comfortable, that I've given them a range of options for knees, ankles, hips, backs, shoulders, and if I need to, trotting around the room to whisper to people. But it's one of those practices that the more often you do it, the more you know what your comfortable options are, and you know how free you are to change your propping and to change your versions. And it's usually just new people that need really explicit permission. Hey, you don't need to look like the person next to you. Have you tried it this way? What happens if you do this? Is this more comfortable? Is that better for your knee if you lie on your back? So on and so forth. And once people are more used to it being a more flexible, pun intended, practicing style, they tend to be a lot more willing to spend the first phase of each pose kind of finding a version that constitutes a safe container for them. Maybe not completely comfortable, but comfortable enough to be in and feel safe.
I think that brings up a really good point. I do think a lot of yin teachers tend to teach a lot of seated forward folds, and you and I both, I guess I've started to come back to them a little bit more, but I don't. I mean, I might teach one in a class.
Mhm,
Although I find now with all the tennis that I've been playing, I really do appreciate more of those forward folds personally.
mhm,
But yeah, I mean, I think sometimes they're overused. I think people forget how many other great ways there are to work with the tissues, but it's so nice and easy to use gravity in a forward fold if the spine is healthy and, uh, and the bones are healthy to be able to use that weight to just work and target and tension large swaths of tissue.
mhm,
Now, I think you talked about two things too that are important, I think, to mention joint replacements. And with joint replacements, what's really important is just to respect the limitation of that now artificial device that we have. And as we get better models of joint replacements, the range of motion for a lot of people, depending on the type of joint replacement they've had, has tended to get better. I just say that very loosely because it really
yeah,
depends on the person and the specific joint replacement the model that they've gotten.
mhm, mm. The
But I just
surgical
really
approach
need
that they
to,
had.
yeah, I need to respect and how much PT and things they personally did
Mhm,
after. So there's so much to it. But so I do need to respect that more isn't always better. And I'm not trying to recapture their pre-surgical range of motion always. Usually there are exceptions of, people who can recapture a lot of that and models that can recapture a lot of that. But I need to respect that because most people aren't the norm for that. The other thing is osteoarthritis, like you mentioned, can have changes in the bony structure of the joint associated with it. So the osteophytes or the bone spurs that can happen, which can impact range of motion. So again, the same thing is I'm
mhm,
not pushing and forcing range of motion, especially when I just feel like I'm at my end. Like when I get to bone on bone, it's not always painful. It just kind of feels like, well, that's it.
mhm.
And so, instead of pushing and pursuing more, and this has kind of been the theme of our whole talk today, is like find that middle path, find that 60 or 70%, look for a gentle tug, don't push, don't force. And a lot of it will be just fine. A lot of
Yeah.
these things.
Yeah, and I do think there is an education process when people are new to yin of more isn't better. You don't have to tuck your feet behind your head. You don't have to rest your stomach on the ground. You're looking for the beginnings of sensation for you. And then the idea is to kind of stay there and see what happens. And sometimes the body does invite you a little bit deeper, and sometimes the body asks you to back away. But if you're not listening for those subtle signals, you can miss them, she says from personal experience. So it is a real practice of listening. And fortunately, it's also one that really celebrates individual range of motion variation. And so it creates a culture that is a little bit more accepting of we're all going to look a little bit different and we might have some different angles and we might have some different props, and that's just how yin is. But it takes a while for new students to get used to that culture and to not approach it the way they would a similar shape in a hatha class or a vinyasa class.
Right? I love that part too because, like,
Same.
it's your pose. It's your pose, and you have to feel where that tug is, and maybe turning your shoulders a little, or maybe turning your hand a little, or rotating your leg a little. Like, I think yin is, we talk about this a lot here. This curiosity is really important to finding the areas that might need a little support, that where you can find a little of that tugging and that tension, not to get rid of it. And again, for those of you who have studied fascia with us or myofascial release, you know the importance of this tension distributing system. I
Mm.
don't want to eliminate tension. That tension is my friend, especially as an athlete, but also just as a human being to have
Hmm.
stable, strong joints. So I'm not trying to get rid of it. But if I approach yin with this mentality of rejuvenating the tissues, I think the whole practice changes a bit rather than trying to get deeper and like go further or look like the picture or get more range of motion, which might happen for people who have lost range of motion. And so, I think just embracing that individuality, like you said, is really important.
Yeah, and I think that's been really similar advice for all of those populations. So, well, fairly similar advice for those populations so far. For some people, maybe to be better just to focus your time elsewhere. For other people, by all means, come, but be appreciative of subtlety in your approach. More is not better. More sensation, more range of motion is not necessarily better. And you mentioned practices that involve a lot of seated forward folds. Gosh, back in the days before I became a yoga teacher, when I was working a desk job for 12 hours a day, I vividly remember going to one yin class that was all seated forward folds right up to shavasana. And I don't know that I've ever been as uncomfortable as I was in that class. And it really stuck with me of, okay, even if you like a seated forward fold and you like that sustained traction right the way down the superficial back line of the body, one, maybe two, maybe three, but
Mix it
not the whole
up.
class, please God.
Give me
So
some work a different part of the body. Come on.
yeah, so it made me think about the next population, which would be, sedentary people, desk working people, people who already sit still a lot. I do see some suggestions online, like maybe yin is not for you. Maybe you've sat still enough and you need to go play tennis or go for a walk or, do a vinyasa practice that has you reminding your body of its other positions and planes of motion. What are your thoughts on that?
Well, I mean, we both agree on this. I mean, I think,
Yeah.
yeah, when it comes to
Spoiler.
time, yeah, probably not the best use of time if you're sedentary. But if that's all, like, especially if someone has some chronic disease or chronic fatigue, like, if that's all you can get yourself to do,
Mhm.
great. It's going to be better than nothing. Yeah, I was probably not going to check the movement box for the day. And at some point, we need to get movement back into your diet. But, um, I think I wouldn't say like it's a contraindication or a no. It's
Yes.
really just more like best use of time, and maybe and keep in mind, like you said, those in quotes sedentary populations are people who are also usually sitting at a desk, which also usually means stress level is often up, especially with
100%.
movement down. There's no outlet when there's no movement.
Mhm.
And so, yin could also be a good stress outlet for people, quieting that mental chatter and
Yeah.
mental restlessness, go for sleep if sleep's an issue. So
Yeah.
again, there's so many other reasons why I might do yin. It's not a no. It's just what's the best for me. It's always like, what's the best use of my time? Because there's so many modalities. If you do yoga with us on Yoga Medicine Online, you know that there are just so many great options. And so sometimes I just have to pick what's going to be most helpful for me today. Do I need to move? Do I need to be challenged? Do I
Mhm.
need to recover? Do I need some nourishment? What do I need? Do I need a little bit of everything? You can have it
Yeah.
all too, a little bit.
You already said it. I couldn't agree more. Is this the very best thing for you to do? Is it the only thing you should do? No. But do you know what? Maybe it's what you need today just to have that little bit of quiet and deliberate stillness as opposed to accidental stillness is very different for the nervous system. If that's what you need today, go for it. But, of course, over the long term, you want to include some other things in your movement diet, as you said, which kind of leads me to athletes, because I've also seen some suggestions online that yin can be, a challenging practice for athletes. Like you're not really flexible enough to do yin if you're an athlete. You might bring your competitive mindset with you and find it really difficult. And again, for me, I'm like, this could be in many ways a perfect cross-training opportunity for athletes depending on how you time it with your other activities.
I mean, you know me, I have so many thoughts on this, but
Mhm.
definitely not something to avoid for athletes. I've worked with a lot of professional athletes, and with pro athletes, it's more just a time element. We do
Mhm.
know from the research that static stretching will impede performance temporarily. It's pretty short-lived, but and it's actually it's really only significant for really high caliber athletes because we're talking about small deficits, but for a high level athlete, anything anything and everything is incredibly important for a professional athlete. And so traditionally it's usually just kept away from sports. So after sports or maybe on, low training days or end of I personally like it end of day. I just think that's the
Mhm.
easiest place to put it. I'll often sometimes you know how I am. I do my MFR and my yen a lot of times while I'm watching a movie at night or something just because I mean, I think that's not the best way to do it if you're new to it, but if you're able to relax, it can be a useful way when you're tight on time. Yes, it's not gonna be the same because you're not gonna get that similar experience of like a meditation and whatnot. But for range of motion, it can be a good way of getting that in. The research also suggests that um, doing 1 minute 5 times a week, if
Mhm.
I am lacking range of motion, so I have mobility deficits in the athletic population, there's always some mobility deficits in certain areas, even in things like ballet dancers, who you think of as being very mobile, and gymnasts and things. So if I am working on range of motion deficits, if I'm trying to recapture range of motion, I do want to do at least a minute. And usually that implies that I'm in it and relaxing for a minute. So sometimes that usually takes a couple of minutes to get there.
Mhm.
But I want to be in it for a minute passively. And then I want to do that 5 times a week. The research suggests is the best for the long term range of motion gains. And so I think the hardest thing with athletes though is a lot of times getting into a lot of these traditional yin shapes can be hard. And this is where I think
Mhm.
MFR is brilliant because it can prepare the tissues for people who are really tight. Now, the other side of the spectrum is for people who are hypermobile in that same class doing MFR before the yin is like not very helpful at all because now they're definitely not going to feel anything.
I don't know.
So
I teach some of these classes,
maybe.
the MFR first and then yin, and I actually love it because for me, it helps me to again recalibrate my settings. I'm really
Mhm.
tuned into, buzzing, tingling, vibration, changes in temperature, as opposed to going for that really big, deep stretch. So it all depends on your application. And if you're a teacher, what you're cueing people to look for. But yes, I know exactly
Yeah,
what you're
there's no
saying
hard and
there.
fast.
Yeah.
I just find personally, I don't feel that tension, that like tugging as obviously afterwards. But yeah, it's going to increase proprioception, so maybe it might help with those people as well.
Mm.
Um, yeah, I think with athletes, the hard part is just getting into the poses, being comfortable there, finding a place in their schedule where they can actually do it to keep it away from like performance and
Mhm.
their training, so that there's no
And
performance
even just
impediments there.
out of the basket of time that they have available, they're probably not going
Yeah.
to have 3 90-minute yin classes available in their week because they've got so many other things to do.
Which is why I love the 1 minute holds. A lot of my
Mhm.
yin classes on Yoga Medicine Online are 1 to 2 minute holds because I just think they're more efficient time-wise, and again, the research suggests that for things like range of motion especially, all I really need are 1 to 2 minutes there, and so it can be a great way to hit a lot of areas, which for athletes, usually it's not just one area, but it's usually
Mhm.
several, and so then I can work through a bunch of different layers and be more time efficient there. So
Yeah, and I think even on the mental side of bringing a competitive mindset into yin being unhelpful, that is definitely true. Coming into yin and being like, I'm going to be just like the ballet dancer next to me, if you're a football player, is not going to be helpful for you. But it can be a really interesting place to learn to have that sense of equanimity of this is what I have today, this is what I'm working with today. And even as you said, to appreciate tension as sporting efficiency. This is what makes me strong. This is what makes my tissues fast and responsive. Relishing the tension as opposed to seeing it as something to be eradicated. It can be an interesting place to start the walkway down towards meditation, as you said, just by having people take a step back and examine physical sensation through a different lens, can kind of invite people into lots of kinds of internal inquiry.
absolutely, totally agree. And there's a whole other conversation about how meditation and things like that can be beneficial for athletes, but I think bringing them into this internal awareness that yin does, as well as other things in yoga, is really beneficial. And I think for especially high level athletes, having that internal awareness is so important so that I can judge. I mean, now we have things like auras and whoop and all of this thing, which is great to tell us where our recovery is. But I also need to have an
Mhm.
internal barometer of where my body's at and what I need, because I don't think, in my opinion, that that is going to be everything. There are a lot of other things that I need to consider, like my enthusiasm for my sport, which is a really
Mhm.
great gauge on my recovery and how my nervous system is doing. Some of those simple things are so there's a checklist you can go through, but I think what I've seen in working with a lot of athletes over the last couple of decades is that having that better body awareness really helps them know when to push and when to take their foot off the gas pedal a little bit,
Mhm.
because we know that as athletes we have to push ourselves as far as we possibly can as a pro especially, but if I go too far, we know injury, illness, all the exhaustion, all the
Mhm.
things that then take us back, 5 steps back from that one step we tried to take forward. And so it is, the name of the game these days is recovery and preventing injuries, because, everyone's training harder and faster and more, and that recovery is such a big part of it. So, yes, I think that introspective awareness that a yin practice, and again, a yin practice can be a great way to do it because it gives us some tactile feedback beyond meditation, which can be really
Yeah.
challenging for people just to sit.
Yeah.
And so it can be a great way to instill awareness. I think MFR is also great for that, but
Mhm.
having a variety of tools, listening, yin gives a different type of stillness that you have to settle into and really forces more introspection, I think, in some ways.
Yeah, I agree. And I think that the key for maybe the whole second group of populations, if the first group was maybe yin isn't the best place for you to spend your time, and the second group was sure, come to yin, but it's all about how you approach it. It might be that less is more approach of little and often at 1 minute, 5 times a week, or 60% of your full range as opposed to 100% of your full range, respecting the signals that you're getting from your body, whether they are from artificial joints or joints with osteoarthritis, or whether it's the joints of an athlete, who had a really hard training session yesterday. It is about training ourselves to listen to those quiet internal signals as opposed to just going through the motions, looking around us and mimicking the shapes that we see. And that can be such a powerful skill for a really wide range of people, I think, to learn in a yin practice.
It's such a good recap. And, I think, you've kind of said this already, but again, I just think one of the hardest things, like you said with the athletes, is just that they feel kind of overwhelmed by approaching a yin yoga class. And it's one of the reasons I've loved teaching yoga for athletes when I was at Nike and a little bit outside of that as well, is just because it's yoga for tight people. You look around and you're not comparing yourself to the person who's a kitten pigeon with their belly on the ground. And so it gives you permission, but to back off and to be where you're at and to look how you are. However, ideally, we can take that mindset in any practice with any surrounding, and
Mhm.
I do think that takes some education and, and hopefully as teachers, I think that can feel overwhelming to feel like it's my job to educate everyone on everything because we just talked about a broad spectrum of people that could be in class, all
Yeah,
that need
all be in
very
the same
different
class.
things. But I think planting those little seeds, investing in the students that come back, knowing
Mm,
that, you know, they're going to learn over time. I don't need to teach everything this one time, but
mm,
there, like you said, were some common themes of like more is not better. Listen to your body, back off if it's painful, but try this other thing, try a different prop. Um, you know, being able to tune in and not have to look like the picture, I think are really common themes that there's not a lot of hard and fast contraindications here, though there might be a few if we just want to draw a quick line and assume that, not all yoga teachers are trained in contraindications and therapeutic populations and how to work with them. And so it might just be easiest to say no to hypermobility and osteoporosis and disc bulges and herniations. But the rest of it, I
mm.
think there's a lot that can be a lot of nuance to it. So,
And we've already
hopefully
offered
this
quite a
gives
few
people some
tips
help.
for teachers, for people who are teaching the average yin class, which could have somebody with osteoporosis next to a 25-year-old ex-dancer, next to a, college football player, next to someone who works at a desk 12 hours a day, 5 days a week. That's a pretty normal cross section of people that might come to a group class. And I think you hit the nail on the head in that it's really natural as a teacher to feel responsible for every single person coming to class having a wonderful experience, but that is a very unrealistic expectation of yourself as one person who doesn't know what anyone's feeling, what they did this week, what they're expecting their body to do after this class. So it really is just about creating an environment where individual variation is recognized and welcome, where you offer a range of options and where you plant those seeds, as you said, that put people in charge of their own experience and don't set a really hard endpoint of this is what the end shape looks like. Here's how you find your way there. And as a teacher who's more mobile than most of my students, when I'm setting up a yin pose, I'm certainly not demonstrating with my stomach on the floor. Even if I can get there, I'm demonstrating in the way that I think probably the bulk of the class is going to be most comfortable. And then I'll give a couple of other options. And then I'll look out for the people who don't have good game faces, who are looking uncomfortable or kind of still fiddling with their props. I might pad over and have a whispered conversation to see if I can help them get more comfortable.
Yeah, and I think as someone you and I are both were more on the flexible end of the spectrum, and I think backing off both in my demoing and in my own practice has
Hmm.
helped me kind of create a new relationship with the practice, but it took a while, and this is really common for people to
Mm,
just not feel much at first. So, know that, and I think that's part of kind of transitioning to a different relationship with this practice as well. And um, I think you did a great job summarizing all those things. But one thing I'll say, to kind of summarize it, I think mobility is such an important part of our life and our existence. I mean, we see this in professional athletes, and I think most people most people in sports medicine will agree that mobility is really essential for longevity of your career as a professional athlete. And obviously, that depends on some more so with different sports, of course. Um, but I think as human beings, one of the things I love about sports medicine, which has always been my specialty, is that it's really just training people to optimize their health and function. And, who
mhm.
doesn't want to have optimal health and function? I think as human beings, maintaining mobility, especially through our lifespan, is so important. Is it the most important? Is it the only thing? No, obviously
Yeah.
not. However, I think we can all agree that it is really important. And for that reason, why, I think yin yoga can probably be beneficial for most people. But,
Mm,
we've talked about some exceptions and some things to keep in mind. And, I think there's always those caveats and contraindications that remind us, the same medicine is not medicine for everyone. For some people, it's poison.
Yeah. And I think that's a really important place to kind of bring the conversation to is it's where you started that there is a potency to this practice. And if there wasn't, we wouldn't be podcasting about it, would we? We wouldn't be teaching it and talking about it and writing articles about it and doing trainings on it and podcasting about it. There is a real potency to the practice of yoga. And that's why so many people love it and do it. But that means that it inherently has power, that it is possible for you to go too far or do too much or approach it in a way that isn't helpful for you. And so, as a practice, it should be treated, I think, with respect, like anything that has power.
Yeah, I agree. We have to honor and respect and appreciate that.
Hmm.
Yeah.
Anything else you want to say to kind of wrap things up?
No, I think that was perfect. And I think, hopefully that really encapsulates some, pros and cons, but also some contraindications and things to keep in mind. Lots of cues and subtleties, I think, for the teachers as well
Mm,
as the practitioners, because again, your teacher can't speak to all of these things every class. I think um, as teachers, the best way to speak to this in every class is to empower your students to be their own best teacher by instead of giving them demands or ultimatums, inviting them into the curiosity of, finding what's helpful for them. And I think these are the ways we really empower them. And then they find instead of being told, because we can't know what's going on with them. We can't know the whole picture. We can't know what they're feeling even. Some people have
mm.
great poker faces, a lot of people. So I think that's kind of the key, the one thing we can do in every class.
Agreed. And I think maybe my only wrap up would be to reinforce that this is one of the few places in modern life that we are deliberately quiet and still and not also watching a movie or scrolling on our phones or in my case listening to a podcast, that there is some real power to that, that even if you set aside range of motion changes and the benefits of mobility and some of the challenges of mobility depending on the population, there is this inherently challenging and nourishing aspect of deliberate stillness and quiet. And it's something that a lot of us lack in modern life. Now, that doesn't have to be 3 90-minute classes a week. That could be one pose before bed, as you spoke about earlier. But finding places in our life to deliberately be quiet, be still, and be undistracted, there's some real power to that.
And I will say for me, because I noticed I mentioned that I do it with movies, and for me, I think of that as more of a stretching mobility practice,
Yeah.
like, and I think really think of yin as this beautiful container, like you said, that
Mm.
contains so much more. But we did talk about the mobility, and I think mobility is one important of many other benefits of this practice, as you said. So I'm glad you ended there and reminding people that there's much more to this practice, like the energetic systems, like the
Mm.
meridians. In our yin yoga teacher training, we talk a lot about the meridians and that energetic influence that we can have and support as well. The, again, gateway into meditation, of course, the mobility work, but also the effects on connective tissue potentially as well, which we know is such a big part of injury prevention because it is the casing around the muscles and is such an important part of our musculoskeletal system. And so, also a way just to rejuvenate the fascia and connective tissue. So there's so many uses, a lot
Mm.
of different things, and there's so much more to this. And we have a full yin yoga teacher training for all the details and research and info on fascia and meridians and energetics and the beautiful three dimensionality of this system. But that gives you something to start to work with. I know there's a lot of yin yoga teachers out there and a lot of practitioners. So hopefully that gives you a lot of information to put to use right away.
And I might also link to in Yoga Medicine Online, we talked quite a bit about flexible folks and hypermobility. I might link to Yenny's balance function for flexible folks, where instead of having a yin practice, she has a myofascial release practice and a restorative practice that give you those opportunities for introspection and deliberate stillness without a big range of motion. So I'll link to that. And we also spoke quite a bit about osteoporosis. So I'll link to the lecture for my Yoga for Osteoporosis series, which also doesn't include any yin classes, just to give you the
And
flip side of the equation.
you can go through our platform, we've got to have hundreds of yin classes now. I know I have a bunch.
Yeah,
So
same.
if you want to search by an area or a theme, or some have acupressure or MFR. I have pranayama in some of mine. I love the combination um, of being able to use a few together and feel them in different ways. So you can definitely search our site and find a whole bunch of gems in there to support your practice.
Brilliant.
Awesome. Well, this was a great discussion. I appreciate, well, we can both appreciate the person who brought this to our office hours calls because they instigated this, and
Thank you very much.
and Google for showing us the common questions and concerns here and being able to have some good, meaningful discussions. So thanks, Rachel. And we look forward to seeing you again soon.
Thanks, Tiffany.
Thanks for listening to Yoga Medicine. If you like the show, please be sure to subscribe and leave a rating and review on Apple Podcasts or wherever you listen to podcasts. And if you got something out of this episode, please spread the word and share it with a friend. You can find more information, articles, trainings, and classes at yogamedicine.com, or check us out on social media as Yoga Medicine. You can also email us at info@yogamedicine.com. Thank you for being a part of our Yoga Medicine community. We look forward to seeing you again. The content of this podcast is not medical advice and is not meant to replace medical care. Please consult your healthcare provider to determine what is best for your unique healthcare needs.